Taking another step towards living with the virus, ministers announce a further easing of COVID-19 rules as we become more resilient against the virus. From Monday, masks will no longer be required. But there are exceptions. If you are a food handler at hawker centres, coffee shops or restaurants, you will still need to wear a mask. And over in Malaysia, the prison service denies rumours that ex-PM Najib Razak will be given special treatment in jail. Hello, you're watching The Big Story with me, Chiao Su Ann. Subscribe to the Straits Times channel to stay up to date with our live news updates. Now, starting next week, mask wearing will no longer be compulsory in schools, offices, restaurants, and even nightclubs. Only if you're fully vaccinated, of course. After over 2 years, masks will now be mandatory only in 2 settings. The first being healthcare facilities, residential care homes and ambulances, as well as indoor premises within hospitals and polyclinics. They will also be required on public transport such as the MRT, LRT, public buses, and indoor facilities such as the boarding areas at bus interchanges and MRT platforms. But according to the Land Transport Authority, masks will not be required on private hire vehicles and taxis, although passengers and drivers are encouraged to keep them on, especially if they feel unwell. So will you be taking your mask off from Monday? I have to say that after more than 2 years, it might feel just a little bit weird to be in a supermarket or cinema without a mask on. Now, many of us are creatures of habit, and according to the task force, that's okay too.
Will there be a day where we will completely remove mask wearing? Well, certainly it may well come, but as we have always been doing, we take these things step by step.
We do hope, even when COVID totally become endemic, we keep mask wearing as a good hygiene habit. When you're sick, wear your mask. When you're very crowded and you're vulnerable, wear a mask. Actually, it will be a good long-term change in social habit.
Now that we are getting used to wearing masks, and going forward, even without COVID-19, when we are not feeling well, even though you have tested negative, please wear a mask if you do need to go out or need to go to work and interact with people. This is a basic public health hygiene practices, and I hope that this COVID-19 experience will help us inculcate that good habit.
Also from Monday, non-fully vaccinated travellers entering Singapore will not be required to undergo a 7-day stay-home notice upon arrival. But they will continue to need a negative pre-departure test taken within 2 days of departing for Singapore. Meanwhile, non-fully vaccinated long-term pass holders and short-term visitors aged 13 and above will not have to apply for entry approval to enter Singapore from Monday. Associate Professor Alex Cook, Vice Dean of Research at NUS's Sosui Hawk School of Public Health, joins me now. Thanks for joining us, Professor. So the easing of mask-wearing measures has gotten many here in Singapore quite excited. As an expert on infectious diseases, what is your take on it? Should people continue to wear their masks or...?
Well, I think obviously we have to keep our mask handy for when we're going in and out of public transport or for visiting hospitals. But in locations where it's not mandatory, it doesn't mean that you cannot wear a mask. It just means that you need not wear one. I would strongly urge that people would still continue to wear a mask if you've got symptoms of a cough or a cold, especially if it's COVID, but even if it's not COVID, if you have to go out and about. Or if any of your family members has got COVID, but even if you don't seem to have symptoms, it's still good to wear a mask when you're interacting with others outside of the family, just in case you're at the early stages of infection. However, for those who don't have any reason to think that they have COVID, because they're not got any symptoms and not got any exposure, I think that we're now at the stage of the pandemic where the damage that someone who is unbeknown is infected and walking about but not yet symptomatic, I think that the risk of damage from them is quite minimal. And so, like in my own case, I don't intend to wear a mask indoors unless I am unwell and I'm worried that I'm going to infect other people.
So along with mask-wearing measures, another COVID-19 measure that will ease is our border measures. How do you think the easing of both of these measures will affect the COVID-19 situation here? Do we expect a short-term spike?
So I would be quite surprised if the easing of border measures and the relaxing of mask restrictions would cause such a spike. The reason why we have the current restrictions at the border on unvaccinated travelers is actually not to stop infections from coming into the country, because those who are vaccinated can still get infected. Rather, it's to reduce the number of people coming in who are unvaccinated and therefore at greater risk of being hospitalized. And if they do get infected and hospitalized, they would then be taking a precious hospital bed. When during the waves, we're already at quite tight hospital utilization. Now that the most recent wave has abated, because most of us have been infected, then the risk of there being pressure on the healthcare system from infections due to either unvaccinated people coming into the country or from the relaxation of mask wearing is much less of an issue now.
So as you mentioned, a majority of people here in Singapore have already gotten COVID-19. But do you have any advice for the people who haven't, especially now as these measures ease?
I think the main piece of advice would be that if you've not had the recommended boosters, it's better to get the recommended boosters now before you get infected than to get them afterwards. I think for everyone else who's up to date with their vaccines and their boosters, we're going to expect that there'll be new waves that wax and wane. And to be honest, I think that there's not likely to be any future time that is safer in terms of COVID risk than now. So yes, you should be taking basic low burden precautions like frequent hand washing and so on. But unless you're at a high risk because of advanced age or because of ill health, it's not clear that there's any kind of long-term benefit now of continuing to take other measures to try to prevent yourself from getting infected, like wearing masks, for example. So just to reiterate that if you do have a cough or a cold, please do wear a mask to protect other people from getting infected.
Thank you for the fantastic advice, Prof. I'll be sure to wear a mask whenever I'm ill. That has been Associate Professor Alex Cook, Vice Dean of Research at NUS's Sosui Hock School of Public Health. Also announced today, booster jabs will be offered to kids aged 5 to 11 years old by the fourth quarter of the year, when exams in primary schools are ending or over. More details will be unveiled later.
Concerning booster vaccinations for children aged 5 to 11 years, EC19V has recommended that these children should receive one booster vaccination dose, and they may receive that booster dose starting from 5 months following their previous vaccination. And in this age range, the Pfizer-BioNTech Comirnaty booster vaccine has been shown to increase antibody levels to more than twice the levels achieved after completing 2 primary doses.
Now, for one group in particular, there will be no change for them from Monday. Food handlers will still be required to wear masks or a spit guard to prevent contamination. According to the Singapore Food Agency, this applies to all personnel involved in the sale and preparation of food and drinks at all retail food outlets, including hawker centres, coffee shops, restaurants and supermarkets. And speaking of the easing of measures, Japan will waive pre-departure COVID-19 tests for vaccinated travellers to the country, but daily caps on entrance will remain in place. Prime Minister Fumio Kishida said that the requirement for tests will be lifted from September 7th, but no decision has been made just yet on a reported plan to raise a daily cap on inbound travellers. In other international news, Malaysia's Prisons Department has denied rumours that former Prime Minister Najib Razak would be given special treatment at Kajang Prison. The department posted a photo that had gone viral, showing Najib's supposed spacious jail cell with a TV, shelves, 3 beds and a table. The photo was captioned, "Stop the spread of fake information." Comments about Najib's supposed VIP treatment had gone viral on social media after the federal court upheld his conviction and sentence of 12 years imprisonment for misappropriating 42 million ringgit. Thailand's Constitutional Court has ordered Prime Minister Prayut Chan-o-cha to stop his official duties pending the result of a legal review of his 8-year term limit. Thai opposition lawmakers had filed a petition last week asking it to rule on when Mr. Prayut's term should end. Wednesday marks 8 years from the day the former army chief became Prime Minister. So just what is Singaporean identity? Is it food, culture, perhaps the way we speak, or a bit of everything? That's what our opinion editor Grace Ho sought to find out when she caught up with former Foreign Minister George Yeo, who has written a new book.
If Singapore is defined by what we can't be, I think it's not a very attractive Singapore. If the common space is created by each of us being less of himself or herself, then it may even be suffocating. The hope I have, as I expressed not only in the first series, but in all 3 series, is that we have a big Singapore. That the unity is created not by how much each has to retreat to create a common space, but how each, by growing his heart and enlarging his mind, can create a greater overlap.
Look out for the full interview with George Yeo on our YouTube channel, where he talks to opinion editor Grace Ho about his new book. Now that's it from me today. Visit straitstimes.com for more news and our YouTube channel for more videos. Subscribe by hitting the red button below. I'm Chao Suan, and I'll see you tomorrow on The Big Story.